Hello and welcome everyone to our Parkinson's Resources webinar series. I'd like to thank everyone for joining us today. I am Melissa Greer from Parkinson's Resources. We are a nonprofit based in Portland with employees in Eugene and Central Oregon. And we provide information and support and educational services to people whose lives have been touched by Parkinson's disease. And we host these online presentations in the efforts to make information on a variety of topics available through live interactive video webinar that are free for anyone to access from anywhere. I hope you all are staying home and safe and well. Parkinson's Resources is trying to reinvent a number of our services to meet the evolving needs of our community during this time. We welcome ideas that you may have and invite you to stay in touch with us via social media for evolving projects such as virtual sing-alongs, mindfulness workshops, and tele-support groups. Before we get started, I just wanted to go over a few details. Please feel free to submit your questions throughout the program in the box provided on your browser on the right-hand side. We are going to save some time at the end of the program to respond to as many questions as possible. A few of you did submit questions to us prior to. I have submitted those to Dr. Dorsey. We will be going over those as well, so just keep your ears open. If you are having any technical issues or challenges, please feel free to submit those in the same question box and we will respond. And so now for our topic today, ending Parkinson's disease. So this is the most talked about new publication on Parkinson's disease in a long time. Within these pages, 4 top experts offer a plan to help prevent what they refer to as a Parkinson's pandemic, improve care and treatment, and end the silence associated with this devastating disease. Dr. Ray Dorsey is here with us today and is one of the book's authors, and we are thrilled that he is joining us via webinar, and I will hand it over to Dr. Dorsey now. Thank you so much.
Thanks very much, Melissa. Thanks so much to your listeners. We want to make this as interactive as possible, so please let us know how we can help you. You know, we're in the midst of confronting 2 global health challenges. One, the coronavirus pandemic, and the second is the fastest growing neurological disorder in the world, Parkinson's disease. One's receiving a lot of attention, and appropriately so, and one's not, and that's inappropriate. And we're trying to change that so that our generation, like generations before us, have ended polio and addressed HIV, that we can do the same for Parkinson's disease and bring about the end of this disease. I know that many of you have lots of questions about COVID-19 and Parkinson's disease, and we're going to address those head on first. And we're going to talk to you how we live in this age of degenerative and man-made diseases, and which might be applicable to both coronavirus and a Parkinson's disease. Talk about the rise of Parkinson's disease, the fastest growing brain disorder in the world, and how we individually and collectively can bring about the end of this disease. And then we'll give some thanks and take some questions from you. So first, about COVID-19, the Parkinson's community. So as all of you know, that older adults and those individuals with serious chronic conditions are at higher risk of complications from COVID-19. And as many of you know, people with Parkinson's, especially more advanced Parkinson's, have impaired swallowing and some respiratory dysfunction, breathing dysfunction, that probably puts them at higher risk. I know none of you are taking this lightly, so I don't even need to say that anymore. And I know you're all staying physically separated, but everyone needs to remain socially connected. All of us need to remain socially connected. And let's just put these webinars and a lot of other activities in place so that we can stay socially connected during this challenging time and work together to overcome them. All of you know to avoid crowds and to let someone else do the shopping. All of you know to ensure that you have an adequate supply of your prescription medications, especially levodopa if you're taking that. You don't need to hoard. We just want people to have 30 to 90 days supply. If people inappropriately hoard, it ends up causing a shortage of the drug for other people who are affected by the disease, and we don't want that to happen. All of you should also be getting outside and exercising to the extent feasible. Fresh air is helpful for everyone. One of my colleagues just did research showing that the number of steps that all of us are taking has decreased by 25% since this outbreak. We need to make sure that we stay physically active, as that's a key factor for improving Parkinson's disease. Few of you smoke and few of you vape, so you're not doing that, but stay away from people who are. You want your lungs and the lining of the lungs to be as healthy as possible. And if you need medical care, do so remotely to the extent feasible. As much as possible, you want to keep COVID-19 out of the hospitals and away from healthcare workers, and you yourself want to stay away from hospitals and healthcare workers who may be infected with the disease, and you don't want other diseases that are present in hospitals to affect you, nor do you want to spread whatever you have to others. So as much as possible, to the extent feasible, try to get your medical care at home. I'm happy to answer any additional questions that people have about COVID-19 and Parkinson's. As many of you know, well, some of you know, we've been providing care via telemedicine for the past 13 years. In fact, I haven't set foot in the clinic in 6 years. I see almost all my patients over the internet. We care for 400 New Yorkers throughout the country, or throughout New York State with Parkinson's disease, and that's funded by three different foundations that are listed here. If you have friends or colleagues who are in New York State who need help with their Parkinson's disease, they can just go to our website, pdcny.org, and they go to our website and they can just they click on the thing that says book an appointment, and if they're a new patient, they click on new patient. 15 seconds later, they complete a questionnaire, and we'll contact them and see them in their home for free through June 30th of this year. And any New Yorker with Parkinson's, we provide care to them in their home for free. So now I want to turn our attention to what's driving the rise of Parkinson's disease. And the French-American scientist René Dubois basically said that every society creates its own diseases. And among those diseases, are clearly things like motor vehicle accidents and lung cancer, which is overwhelmingly due to smoking. But we also contribute to many other diseases, including both coronavirus and Parkinson's disease. And this epidemiologist, Dr. Abdul Omran, in 1971, highlighted 4 different phases of what caused the death of individuals, death of humans. Initially, early humans died from pestilence and famine. Quite simply, we didn't have enough food. And then the agrarian revolution about 10,000 years ago provided food for the vast majority of humans, but we were still susceptible to infectious pandemics. So the bubonic plague in the 14th century, the influenza pandemic in 1918, which killed about 50 million people around the world. And now we live in the age of degenerative and man-made diseases, and we'll give you examples of that and talk about how Parkinson's disease, to at least some extent, is likely a man-made disease. And then he even postulated, Dr. Omran, that in the future we would die from delayed degenerative diseases and emerging infections born out of hubris. He called it hybristic. And if people have been following the coronavirus COVID-19 story closely, they'll realize that it likely began from an animal source, bat, and perhaps by way of another animal called a patagon, I believe, which is like an anteater that in Chinese markets are slaughtered and given as a delicacy for the rich and wealthy and powerful who are seeking to eat wildlife animals rather than animals that are intended for human consumption, or at least animals more geared toward human consumption. The result being that we're passing viruses from wildlife animals into humans when in fact shouldn't be having any contact or any meaningful contact between these animals and humans. We cure ourselves of our desire to eat wildlife animals. We can cure ourselves of and prevent ourselves from ever having COVID-19 and similar viruses. So the most one clear man-made disease is lung cancer. And so before the advent of cigarettes, doctors took special notice when confronted with the case, thinking it was a once-in-a-lifetime oddity. If you look carefully at the graph, if you look at lung cancer deaths in the 1920s, there's almost none. There's almost no lung cancer deaths in the 1920s. And that's because no one was smoking cigarettes, and there was no reason that it developed lung cancer. So you can see about 25 years after cigarettes were introduced, you can see a very similar rise in lung cancer death that mirrors that for smoking. Similarly, you can see a decline 25 years after the cigarette smoking peak. You can see a peak in lung cancer death, beginning decline in relationship to reduction in cigarettes. What does this have to do with Parkinson's disease? Well, Parkinson's disease was very rare prior to 1817, before Dr. James Parkinson described the condition in his essay on the shaking palsy. It was almost non-existent. It was still rare cases, but Dr. Parkinson was a 61-year-old doctor in England, London at the time, and he was describing in his work something that had not been classified in the medical literature. He was describing 6 people that he saw walking on the streets of London with a new condition, a condition that included a tremor, but also included a stooped posture and a shuffling gait, which was new to him and new to the medical field. 50 to 60 years later, Dr. Jean-Marc Charcot, the father of modern neurology, named the disease after him, calling it La Maladie de Parkinson's, or simply Parkinson's disease. In 1912, the pathology for Parkinson's disease was first described by Dr. Fritz Louis. In the 1950s, research identified that individuals with Parkinson's disease had lower levels of dopamine in their brain, which led to the development of levodopa, a dopamine precursor in the 1960s. In 1983, Dr. Bill Langston in Northern California described the first environmental cause of Parkinson's disease. A chemical called MPTP was a contaminant that was being produced in street forms of heroin and causing acute Parkinsonism in young adults. In 1997, the first genetic cause for Parkinson's disease was identified by researchers from Italy, Sweden, and the United States. And importantly, many of those genetic factors that have since been identified are known to interact with environmental factors linked to the disease, such as pesticides. In 2003, Dr. Heiko Brock, a German pathologist, posited that Parkinson's disease may naturally not begin in the brain, but begin in the nose or in the gut. And today we have the world's fastest growing brain disorder. So what's going on in 1817 when Dr. Parkinson described the condition? Well, in 1817, it's the height of the Industrial Revolution, and England's the capital. The London fog at that time had little to do with weather and everything to do with air pollution. If you look closely at the picture, you'll notice a few things. One, the pollution was so bad you couldn't see across the street. Two, everyone's covering their mouths. Both the woman, presumably her husband, and their son all have their mouths covered. Three, this picture should remind people of what modern-day Beijing looks like in pictures from that area, where people walk around with masks even before the coronavirus was present to protect themselves from air pollution. So what Dr. Parkinson was describing was the rise of a new disease in an area of the world associated with the Industrial Revolution, and an area of the world associated with air pollution. Air pollution has since been linked to Parkinson's disease, and the areas of the world that have the world's fastest growing rates of Parkinson's disease are those that are undergoing rapid industrialization, like China. And as I mentioned several times now, Parkinson's disease is the fastest growing brain disorder. The number of people with Parkinson's disease has doubled over the last 25 years. And absent change, if we don't do anything, twice as many people will have Parkinson's disease by 2040. So the challenge to us is to prevent that, is to make that projection wrong, to make it flat, and then so that 25 years later it reduces. And that's the challenge to us and our generation with respect to Parkinson's disease. As many of you know, Parkinson's disease, the initial symptoms of Parkinson's disease aren't tremor and slowness in movement, but loss of smell, which begins decades before the tremor does. And loss of smell corresponds to pathology of Parkinson's disease found in the nose or the olfactory bulb part of the brain. And then another early symptom of Parkinson's disease, again, years before tremor and slowness in movement develop, is constipation. And again, many of these risk factors, such as air pollution, enter in through the nose, or pesticides enter in through the nose or inhaled, or in through the gut. all providing us clues to what might be driving the rise of Parkinson's disease. These are data on air pollution, and you can see prior to 1850, prior to the time of Dr. Parkinson, air pollution largely was a non-factor for most of the world. Air pollution first increased in Europe, then in North America, especially United States, and more recently in Asia. And if you look at the rates of Parkinson's disease, you indeed find them to be highest in areas of the world with highest rates of air pollution, such as Europe and North America, most rapidly increasing in those areas with increasing rates of air pollution, Asia, and lowest in least industrialized parts of the world, such as sub-Saharan Africa. In addition, some studies have found that the pathology of Parkinson's disease begins in the gut, where pesticides can also enter the body. There have been naturally occurring pesticides for millennia, and the synthetic pesticides, man-made pesticides, were introduced in World War II and shortly after World War II, and have been increasing in use ever since then. Numerous studies have linked certain pesticides to Parkinson's disease. Studies in the US, in Canada, in France, and many parts of the world have found this association. One of these pesticides, called paraquat, looks much like MPTP, the chemical, the first environmental cause identified by Dr. Bill Langston in 1983. Paraquat has been described as the most toxic herbicide ever created. It kills the weeds that Roundup doesn't. The EPA on its own website says 1 sip can kill. And 32 countries, including China, have banned the pesticide or the herbicide. However, the United States has not. And in fact, use of paraquat over the last 10 years has actually doubled in the United States. And you can even see some of it there in Oregon, where many of you are listening or watching this webcast. And it's literally found in numerous parts of the United States, including areas close to where I live in Rochester, New York. Paraquat and certain pesticides are not the only environmental risk factors for Parkinson's disease. Another chemical called trichloroethylene has also been linked to Parkinson's disease. It's used by numerous individuals, widely used by dry cleaners. It's an outstanding degreasing agent, so it's been used by mechanics, oil processors, printers. It's found in numerous consumer products, in whiteouts, for example, found in adhesives and glues and carpet cleaners, paint removers, and in the 1970s was even used to decaffeinate coffee. Today we have use of trichloroethylene has diminished, but it's not banned in the United States as it is in other parts of the world, and numerous contaminated sites throughout the country have it. And the trichloroethylene is often just poured into the ground, where it then contaminates groundwater. Up to 30% of groundwater in the United States is contaminated with trichloroethylene, also known as TCE. And much of the TCE can migrate in plumes that are underground, then evaporate into the soil and affect people with the disease. In our book, Ending Parkinson's Disease, we tell the stories of individuals affected by TCE, including Danny Fromm, who is pictured here with his friends and colleagues in the 1980s. I'm just going to read you a brief excerpt from the book that gives you a sense of Danny Fromm in the book itself. In 1988, Danny Fromm was a typical Southern California teenager who enjoyed working on cars, especially his red 1972 Chevy Nova with a black top. He paid $1,300 for it, money he had saved from working as a gas station attendant at the local Unical 76. Fromm and his buddies replaced the car's engine, which made it really awesome and really fast, he recalled. The car gave the 17-year-old the freedom that he craved, freedom to do what he wanted when he wanted, freedom that he no longer had. Straight out of high school, Fromm began working in the aerospace industry, cleaning circuit boards with solvent trichloroethylene, or TCE. Never warned of any risk or provided with protective gear, he inhaled the sweet-smelling chemical and exposed his skin to it for 8 hours a day over the course of a decade. When Fromm was 35, he noticed that his right pinky kept twitching. distressed, his first doctor said, and recommended a little wine. The second doctor gave him a much different diagnosis: Parkinson's disease. After Fromm subsequently started levodopa and his symptoms improved, but he developed complications of it, including involuntary movement, so he had deep brain stimulation. Returning to the book, Fromm is now 48 and lives in Idaho with his wife and 6-year-old son, Logan. He has 2 older sons who live nearby with their mother. In the morning, Fromm has trouble walking. He has what he calls a hardcore shuffle. So he takes his medication immediately after he wakes up, and he does leg exercises to relieve his leg stiffness. He's been able to get out of bed, shower, and dress without assistance. A little bit later, I pick up again. Fromm regrets every day that he stayed at his aerospace job working with trichloroethylene, sometimes called tri or trike. While the solvent has not been proven definitively to cause Parkinson's, those who are exposed to it at work are 6 times more likely to develop the disease than those who are not. If you're working with it, Fromm says, quit your damn job and get away from it. Danny Fromm, who he and his wife sent me these pictures, now lives in Idaho, not too far from many of you. Lives with his youngest son, Logan, pictured there, and his other sons are nearby, and spends a lot of time outdoors. He told his story, and many other people shared their stories in their book, so their stories are not repeated, and we can learn from them. So trichloroethylene, New York Times reported, was ubiquitous in the 1970s, and I just provided some examples of products that were used. In England, estimated that up to 8% of workers work with trichloroethylene. And there are half of Superfund sites in the United States are contaminated with the chemical, including some in Oregon, and 21 alone in Silicon Valley. In addition to these contaminated Superfund sites, there are thousands of others throughout the country, including one 15 minutes from my house that I learned in the process of writing this book. As I alluded to, dry cleaners, military installations, and industries are all prone to dump trichloroethylene directly into the soil, as you can see in the right part of the picture. The TCE is then contaminates groundwater, migrates in plumes, and affects nearby residences and office buildings where it can evaporate into those homes undetected. This is the neighborhood at 15 minutes from where I live and where I'm doing this webinar right now, in a town called Victor, New York, that was contaminated with trichloroethylene from a plume of TCE that likely started at a standing gravel pit at the bottom of the picture on your right. And you can see how far that plume can migrate into the homes, neighborhoods that it can contaminate in the area. One person whose story we tell in the book, I used to run by that gravel pit 3 times a week until one day that person noticed that he couldn't make it up the hill any longer and was subsequently diagnosed with Parkinson's disease. Now, it's hard to say whether that was a coincidence or whether there's any link there. But there are numerous individuals who have developed Parkinson's disease after working or being exposed to the chemical. Now, we're not alone in this. There are thousands of sites, as I alluded to, 21 in Silicon Valley that are Superfund sites and many others that aren't Superfund sites. There are thousands of sites in Michigan and numerous ones in the West as well. And again, to the picture of Las Vegas, Nevada, you can see in red the initial source of the plume. You can see how far that plume can extend and affecting the residences and buildings above it. Jane Horton lives across the street from one of those Superfund sites in Silicon Valley, actually underneath the current headquarters of Google, because Intel and Fairchild Semiconductor companies use TCE to clean silicon wafers and deposited the TCE into the ground. And Ms. Horton lives underneath one of the plumes. She had her indoor air tested and was found to have much higher levels than permissible by law and that are quite frankly safe. She had a TCE remediation system installed in her house that simply pumps air from underneath her foundation and releases it above her house. So even though this is really common, it's readily treatable, and people can live, even if they live on top of a plume, they can have a remediation system put in, much like a radon remediation system put in, and breathe healthy and clean air. In the book, we provide a prescription for action and resources and phone numbers for people to call if they're concerned about contaminated either groundwater or air. For example, the website for breathing fresh air is epa.gov/vapor intrusion. And again, this is all in our book. So how can we end Parkinson's disease? So there's some hopeful notes out there. Almost every area of the world has increasing rates of Parkinson's disease, although the Netherlands appears to have a decreasing rates of Parkinson's disease. And when we look back at this study and try to figure out why might the rates of Parkinson's be declining, we found three potential reasons. One is that air pollution in the Netherlands has decreased by more than 50% between 1990 and 2012. Second, Netherlands was among the first to ban some of these pesticides. In addition to paraquat, there are some pesticides such as DDT and Agent Orange and deoxyrin, which dissolve in fat. And as many of you know, the brain is a fatty structure, and residues of these pesticides have been found in the brains of individuals with Parkinson's disease. When you looked at the fat levels in the people in Dutch people, you found that these levels had decreased by 75 and 90% between 1968 and 1986. Finally, levels of TCE in the air in Netherlands were among the lowest in the whole continent as of 1981. Again, I can't say that these are definitely causing the decreasing rates of Parkinson's in the Netherlands, and indeed some research suggests that these rates might be increasing, but nonetheless, the trajectory of rates in the Netherlands and Western Europe have been slower than other parts of the world that are undergoing more rapid industrialization. So we highlight a prescription for action in the book that's focused on a PACT, P-A-C-T, that we and the entire Parkinson's community can take to prevent the disease, to advocate for better policies and additional resources, to care for all those that are affected, and to treat the condition with novel therapies. There's some simple things we can do to ban paraquat and trichloroethylene. The EPA has proposed banning both, but bans on those have either not been taken up or have been postponed indefinitely. Congressman Lydia Velasquez from New York has introduced a bill that would ban paraquat in the United States. Most of you know that vigorous exercise helps individuals with Parkinson's disease. In addition, vigorous exercise in their 40s and 50s can decrease your risk of developing Parkinson's disease a decade later by 20%. Additional evidence suggests that a Mediterranean diet, low in animal meat, low in animal products, can decrease your risk of Parkinson's disease, as can modest amounts of caffeine, the equivalent of 1 to 4 cups of caffeinated coffee, may decrease your risk of Parkinson's disease. Most of you know that head trauma also increases your risk of Parkinson's disease, so you should wear a helmet when doing activities that are susceptible to head trauma. We need to increase our amount of resources devoted to funding Parkinson's disease research. At the same time, the number of Americans with Parkinson's has increased by 35%. Funding from the NIH, adjusted for inflation for Parkinson's disease, has actually decreased. In the setting of the fastest growing increasing brain disorder, funding for Parkinson's research has actually decreased. We need to care for everyone that has the disease. 40% of Americans with Parkinson's disease don't see a neurologist soon after they are diagnosed, and those that don't have worse health outcomes. We need to bring care to patients instead of patients to care. One small silver lining of the coronavirus pandemic is that we're realizing we have the tools, technology, and ability to connect to people on their terms instead of having people come to see us in clinics. This is especially important for people with Parkinson's disease who don't live near these centers, have impaired mobility, impaired driving ability, and overburdened caregivers. And then we need new treatments for Parkinson's disease. The most effective treatment for Parkinson's disease is now over 50 years old. It doesn't address the underlying pathology of the disease and has complications of its own. We need better measures of the disease so we can more efficiently identify new treatments for the disease. and we need to enable all of you to be able to participate in research studies on your terms without having to necessarily go to research sites constantly to participate and adding to your burden. Obviously, this book would not have been possible without our co-authors, Dr. Todd Scher, named misspelled here, who's the CEO of the Michael J. Fox Foundation, Dr. Michael Oken, and Dr. Boss Bloom. Dr. Michael Oken is the chair of neurology at the University of Florida and the pioneer in deep brain stimulation. Dr. Boss Bloom is one of Europe's most prominent Parkinson's specialists, has created the world's largest expert care model for Parkinson's disease called ParkinsonNet. Obviously, a huge team at the University of Rochester has been responsible for much of the work. And we really want to thank the individuals who shared their stories that are all featured in the book, Ending Parkinson's Disease. Some of these individuals have Parkinson's disease, some are researchers, some are advocates, all share a common vision of having a world without Parkinson's disease. So we need to make our voices heard. In the 1980s, HIV activists confronted an unknown virus that was associated with a rapidly fatal condition known as AIDS, and there was no federal response. So a far worse situation than the one we confront now. They adopted a model of silence equals death. And for Parkinson's disease, silence equals suffering, and in many cases, needless suffering. We need to make our voices heard. We'd love everyone listening to buy the book. That's one way to make our voices heard, because if we're not interested in reading about how to end Parkinson's disease, no one else will be. All the authors are donating all of our proceeds from the book to efforts to end Parkinson's disease. This is an investment in the community. It was written for the people in the community. We dedicate the book to those affected by Parkinson's disease and to those who will help end the disease. I look forward to your questions, and more importantly, I look forward to all of us working together to end this debilitating disease for us and for future generations. Melissa, I'm happy to take any questions that.
Okay, let's open up the questions. If everyone, they have a question option on the side, go ahead and submit some of your questions now. So one question was about if there's any useful, or I'm sorry, any good pesticides that can be used?
Yeah, so there are numerous pesticides that aren't linked to Parkinson's disease, and so those can be used. I'm not a farmer, so I'm not going to tell you what pesticides to use, but the pesticides that are most implicated in Parkinson's disease are those that dissolve in fat. It's worth noting that many pesticides are nerve toxins, so these are very concerning. In the book, we actually highlight the story of a woman who became the sixth member of her family of farmers to develop Parkinson's disease, and that her current generation of people who are relatives who are using that farm have made it into an organic farm. So there are lots of alternatives that we can use to avoid the risk of Parkinson's disease. It's worth noting that numerous studies have also found that farmers, for example, are at 50 to 200% increased risk of developing Parkinson's.
Okay, and then we have a question about what type of diet is best when it comes to preventing Parkinson's disease.
Yeah, so the Mediterranean diet, we outlined that more in the book, is useful for Parkinson's disease. So I don't know if people actually, some people might have read the book, but chapter 10 outlines what people can do and the specifics about the diet. So the Mediterranean diet is high in fruits and vegetables, beans and nuts, whole grains, fish, olive oil, and characterized by small amounts of meat and dairy. And I'll just say, you know, even for me, I learned a ton writing this book, and I've changed my eating habits, I've changed my exercising habits, and I've added, you know, water filters to our water at home, all based on my experiences and learnings from writing this book.
Okay, and then another question is, I live in a rural area and have a well for my domestic water supply. I use an irrigation in the summer for vegetable gardens. What tests should be done on the water to make sure I am not introducing bad chemicals into my vegetables?
Great. So 40 million Americans get their water from wells and private wells as opposed to municipal water. And private wells, which reside on people's residences, are very susceptible to contamination from pesticides that are, for example, sprayed on farms, washed off by rain, and then contaminate the groundwater. And unlike municipal or city water, which is subject to the Safe Drinking Water Act and therefore regularly tested, private wells are not. And they're often only had their water tested when the house is bought or sold. So we provide in the book references for the EPA Safe Drinking Water Hotline, which is 800-426-4791. Again, 800-426-4791. And then we give you a link to a website on EPA's website on private wells, which is epa.gov/private wells. Because it's a major issue. So we mentioned the risk to farmers, but individuals from rural areas are also high risk of Parkinson's disease. In Nebraska, which has a registry of individuals with Parkinson's disease, rates in rural parts of Nebraska outside of Omaha are 2 to 4 times greater than they are in the city of Omaha.
Okay, great, thank you. And then there's a question about the connection on how Western medicine understands Parkinson's disease and how Chinese medicine understands and treats it. It seems to be that there's some missing, that we seem to be missing a lot of wisdom there. Can you speak to that?
Yeah, so, well, one Eastern approach to Parkinson's, to exercise is Tai Chi. So there was a study done of Tai Chi, for example, for individuals with Parkinson's disease, published in the New England Journal of Medicine, which showed that Tai Chi decreases the risk of falls and improves balance in individuals with Parkinson's disease. I'm not well versed. There have been some studies of acupuncture for Parkinson's disease. I don't think that they have demonstrated significant benefit. I think we have a decent sense of what's causing the disease. We need to prevent people from getting it. We need to use health practices like exercise to decrease our risk. To improve our quality of life. And then we need to appropriately use medications like levodopa to help individuals who need it.
Okay, and then there's another question about if there's any advances or improvements in medication for Parkinson's disease.
Yes, and just one other thing, there's also a plant called a fava bean plant called Mucuna purine found in Southeast Asia that contains levodopa that's often used. As opposed to new treatments on the horizon, we're actually planning to have a webinar, and Melissa will share this with you. Michael Oken, one of the book's authors, we're planning a webinar for April 1st at 6 p.m. Eastern time that will just have a whole lecture devoted to new treatments for Parkinson's disease. First thing we need to get new treatments is we need better measures of the disease. So many of you have Parkinson's disease, and many of you know that when you go to the clinic, we have you tap your thumb and index finger as big and fast as you can 10 times. And based on that, we score that from 0 to 4 using a categorical scale, 0, 1, 2, 3, and 4. We need better measures of the disease that aren't subjective, that aren't categorical, and that reflect not how you do just in the clinic, but how you do at home. Most of us carry around supercomputers with us everywhere we go, and those can give us objective, essentially sensitive, frequent data on how we're doing, and that's far more meaningful than these episodic assessments. As long as we have bad measures of the disease, or subjective measures of the disease, or limited measures of the disease, it's going to take us a long time to find new treatment. So first, we need better measures. Second, we need treatments that are aimed at the underlying causes of the disease. So there are now some gene-targeted therapies, both for a mutation called LRRK2, LRRK2, and this other gene called GBA that are in development right now. These hold the hope of addressing the underlying causes of the disease for a subset of individuals. And it may be that these genes or proteins have abnormal function even in people who don't carry the genetic mutations responsible for the disease. So we need better measures of the disease. We need treatments that are targeted at the underlying causes of the disease, and then we need to prevent the disease for those who don't have it.
Okay, and then there's a question that asked about what can we do as far as advocacy to be sure that the chemicals that you discussed are completely banned worldwide?
Yeah, so there's a lot that we can be done. So in the 1950s, there was a March of Dimes in which individuals literally sent dimes to the White House to raise money to care for people with polio and develop funds for a vaccine. You can think about what we need to do with something along those fronts to address the coronavirus pandemic in front of us. And again, the HIV activists and the 80s and the breast cancer activists in this century have provided us models for engagement. HIV activists shut down the FDA, insisted on meeting with the NIH, shut down Wall Street, engaged in activism that included a AIDS quilt that covered the National Mall. I don't think I've ever seen a march on Washington from the Parkinson's disease community. We have 1 million Americans who are affected by the disease, and another 200 people will be diagnosed today, another 1,000 this week, and 60,000 this year. If those individuals marched on the EPA after this pandemic has passed, we would see changes in the way that we regulate these chemicals. And we'd get rid of them and save lots of people and lots of families and lots of caregivers the stress and strain and that comes with Parkinson's disease.
Thank you. And then kind of talking about the disease itself, when we say Parkinson's disease, and there are so many manifestations of the disease, someone is asking if it should be called a syndrome.
Yeah, and we discussed that in the book. One colleague said it should be called Parkinson's diseases because there are multiple different causes of the disease, some likely primarily genetic, some likely primarily environmental, many, if not most likely, interaction between the two. And the syndrome itself is not even primarily a brain disease. Likely it might be, it's a multi-system disease that affects numerous systems, everything from the nose to the gut, to the heart, to the lungs, to sexual function, to urinary function, to sweating, to the skin. There's hard to think of a organ system that's not affected by Parkinson's disease. And indeed, we have a multi-system disease or multi-system syndrome with multiple causes that we need to work to stop.
So in that, you mentioned the nose and kind of sense of smell. What other factors may cause that? So someone is kind of asking if that's something that someone sees early on. Is it for sure that they will be that potentially could develop Parkinson's within that decade?
So there's lots of research that shows that loss of smell is associated with subsequent development of neurological diseases, especially Parkinson's disease and Alzheimer's disease. Now, lots of people lose their smell, and you just saw a study on COVID-19, the coronavirus, causing loss of smell, and people have transient losses of smell, which likely have nothing to do with developing that Parkinson's disease. But we do know that individuals who do lose their sense of smell are at increased risk for developing the disease, usually decades later, but it can be a concerning sign, early sign of disease, as can other things like acting out one's dreams, something called REM sleep behavioral disorder, where people normally are paralyzed during periods of active dreaming, but some lose that paralysis and act out their dreams and might strike their bed partner. So there's some early signs of disease, which also provide us an opportunity to test out new treatments, pharmacological ones or non-pharmacological ones, early in the disease course. and lots of research, including that from Michael J. Fox, is focused on these individuals.
Okay, thank you. So we're getting some questions about some links to kind of either early head traumas from football or soccer leading to the development of Parkinson's, but then also a question about being exposed, kind of, even golfing and being exposed to some of the chemicals, Power Cat, I'm assuming. So can you speak to any of those kind of early exposures, and if that is something that might have led to a Parkinson's diagnosis?
Yeah, so in Chapter 6, we take on head trauma, and Chapter 10, we take on golf. Many people know that Muhammad Ali developed Parkinson's disease that was likely contributed to repeated head trauma and concussions. There have been studies that NFL football players that found 110 out of 111 NFL football players had chronic traumatic encephalopathy, not Parkinson's, but chronic traumatic encephalopathy. But 2/3 of them had symptoms of Parkinsonian features, including tremor and difficulty walking. Studies have also shown that even one significant head trauma with loss of consciousness can increase your risk of Parkinson's disease. It's also a huge issue for the military. We provide you graphs on all of that. And so we need to reduce our activities that are associated with head trauma and protect our heads. And then on golfing, there have been one report showed that 16 out of 18 people with Parkinson's disease who live near a golf course live downwind of that golf course. It's not a huge study, but it again raises the question about whether pesticides commonly used on golf courses might be associated with Parkinson's disease.
Okay, and then the last question that I have, if there's any more questions, please submit them, but there's one that's discussing, and just when people say that the Parkinson's might be starting in the gut, what do you mean by that? Can you just elaborate for us, please?
Sure. So the evidence is stronger for the nose than for the gut, but that the pathology of Parkinson's disease are called Lewy bodies, this misfolded protein known as alpha-synuclein. And so you can find that pathology first in the nose before you find it in part of the brain that's responsible for tremor. So the clinical features, the symptoms of Parkinson's disease, constipation, loss of smell, follow the pathology, the spread of pathology. So the pathology is first found in the nose, and the first symptom of Parkinson's disease is loss of smell. The next place that Parkinson's disease is found, another place where Parkinson's disease is found, the pathology is found early, is in the gut, and you see constipation early in the disease. You also then see parts of Parkinson's disease found in the brainstem, the part of the brain that connects the brain to the spinal cord, and this part of the brain is responsible for some of the what we call involuntary symptoms like control of heart rate, which is impaired in Parkinson's disease, as well as near parts of the brain affected by sleep, which is affected early in the disease course. So the spread of the pathology of the disease correlates with the spread of the symptoms of the disease, and that tremor and slowness of movement are just mid-stage symptoms of the disease that have been classically associated with Parkinson's. I think I do a better job in the book than I did right there explaining it.
Well, kind of going back to that question about golf and kind of that earlier exposure, is there kind of a timeline that shows up when someone is exposed to something early in life, and what that looks like when symptoms start to show later in life as Parkinson's?
So we don't know because we don't have great data. Just like you don't start smoking cigarettes and then develop lung cancer the next day or the next year, we think there's a lag, because we know it takes years to develop lung cancer, and we know it takes years to develop Parkinson's disease. Some researchers have speculated that these environmental exposures might occur early, and indeed, indeed in the book we highlight that some of these pesticides dissolve in fat, and the only time they actually leave the body of humans is when women nurse their babies. And so these pesticides have been found in breast milk of nursing mothers, and that breast milk contaminated with the pesticide can go into the nursing child and affect and potentially affect their brain and their developing brain. Indeed, one could hypothesize, no great evidence for this, that early exposures when you're a young growing child in developing brain might be more susceptible to the effects of it. One pesticide called chlorpyrifos, which has been associated with Parkinson's disease, is estimated to have cost 25 million children 16 million IQ points. So we need to prevent the disease to the extent possible. There is little downside in doing so, and only huge upside for Parkinson's disease, and likely for a wide range of other neurological disorders.
Okay, thank you for that. Any last questions?
So while they do, they can, to order the book, you can just go to Amazon.com, type in Ending Parkinson's Disease. You can just type in Ending Parkinson's Disease into Google. You can go to Barnes & Noble. You can go to our website, endingpd.org, which has additional references and resources about Parkinson's disease, including for veterans and for farmers. And then if you have like support groups, you're part of support groups, you can buy discounted copies of the book through BookPal. You just go to bookpal.com and type in Ending Parkinson's Disease. Copies of the book for bulk orders starting at like 25 units are only like $15 a book. You know, I myself did a bulk order through BookPal because we sent it to all the people who contributed their story, sent copies to all the people who contributed their stories. If we don't take up this challenge, no one else will. Just like in polio, with those people at risk of polio who took up the challenge. For HIV, it was those individuals, largely homosexual men, who took up the challenge and helped prevent, thousands, if not millions of people, including people listening and their families, from ever developing HIV through prevention. And it was people affected by breast cancer most directly in this century who've taken up that challenge, initially creating a peach ribbon and then a pink ribbon, and gathering together to address that challenge. And we tell the story of all of those affected by polio, those affected by HIV, and those affected by breast cancer in the book as a model for what we can do for Parkinson's disease. Our greatest legacy could be that we're the generation that took action to end Parkinson's disease, just like our predecessors have done so for polio.
Okay, thank you so much. So I was having a little trouble with the section of the question section. So if your question did not get answered, please email me, and I will try to get those to Dr. Dorsey. Thank you so much, Dr. Dorsey. I'm happy to email everyone as well with the any kind of link to the book, and we appreciate it so much. This was a recorded webinar, so you can find this video recording on our YouTube channel, as well as some previously recorded webinars. And you can find that at our website, the link on our website at parkinsonsresources.org. Again, if we were not able to get your questions answered, sorry, please email me at melissa@parkinsonsresources.org. Once again, like to thank Dr. Dorsey for taking the time to do this webinar for us. We're all excited about this book, and we do have some available for sale at our office. So if you are local, and just go ahead and give us a call on our helpline, and we can try to get that to you. We'll leave it on a bag at the door, and you can just grab it from there. So everyone be safe, stay healthy, and this concludes our webinar broadcast for today. Stay tuned for our next webinar on April 8th on genetics and Parkinson's disease. Again, thank you, Dr. Dorsey, and thank you all for attending.
Thank you very much, Melissa.